Hi all, good morning. This is Dr. Neema Bhat, Senior Consultant Hematologist, Bone Marrow Transplant Physician, Pediatric Oncologist at Apollo Hospitals, Bangalore. And I'm speaking out of my clinic at Therrapie, Hematology and Oncology Care here in Banashankari, Bangalore. January is the month of awareness regarding multiple health issues, but it's also the month of awareness about blood and blood product donation. Being a hematologist myself, I would like to take a couple minutes to talk about this. So why is blood donation important? From two angles, we can look at this point or this topic. One, what is the benefit for the person who's receiving blood? And the second point is, what is the benefit for the person who's donating blood? The people who are receiving blood, of course, we know that patients with a lot of chronic disorders, like it can be beta thalassemia, it can be sickle cell anemia, aplastic anemia. Patients are receiving chemotherapy for various diagnoses, cancer diagnosis. Patients who have other blood disorders like severe anemia, either it could be nutritional anemia or what we call hemolytic anemia. So basically anybody with a low hemoglobin that requires regular blood transfusions will benefit hugely from blood donations. Although India has a very high population, the number of blood products that are proportionately available based on the population of India are not as adequate if you compare it to Western countries. Although we have a lot of healthy donors, the awareness about donating blood on a regular basis is not as prevalent. So what is the advantage of blood donation for a normal person? If you're an adult between the age of 18 to 45 years of age and don't have any chronic illness like severe blood sugars that are not controlled, severe hypertension, if you are not a chronic avid smoker or alcoholic, then you are an eligible adult who can go in for blood donation. How can it be helpful to you? So as you know, blood or bone marrow is constantly at work generating or making blood products every minute. So anything that has been circulating for quite some time tends to start getting a little old. And one of the advantages of giving blood once every 3 months is sort of a method of purifying your system and also making sure that fresh blood is now circulating in your body. This is very loosely put, but it can be of great health benefits to regular individuals. How often can you donate blood or other blood products? Previously, we used to take blood and directly transfuse to the patient. That was called whole blood transfusion. But now we split these blood products. We take a unit of blood from one person and split it into red blood cells, platelets, FFP or frozen plasma, cryoprecipitate. So various components can be derived from one unit of blood. So your single unit of blood can be of use to multiple patients simultaneously. And you can donate blood as often as once every 3 months, sometimes even more frequently, even once every 2 or 2.5 months if your hemoglobin is excellent and you're in a very good state of health and you're a young individual who's fit and fine otherwise. Apart from blood, what else can you donate? So we talk about blood and blood products. We don't talk about stem cells as much, which again is a huge lacking awareness in India. So there is something called stem cell registry or bone marrow registry, which we use stem cells for doing bone marrow transplantations in various conditions related to blood disorders and also some non-blood disorders. So these stem cells or bone marrow cells can be life-saving. So just like blood can be life-saving immediately, these bone marrow cells or stem cells can be life-saving in the longer term for some patients who may be suffering from, say, blood cancers or some blood conditions like sickle cell anemia or thalassemia, or it could be something like aplastic anemia. If they don't have a full match in their family, then finding a donor from the blood bank or bone marrow registry is going to be of huge help to them, and it can be a life-saving procedure. So please find out more, be more inquisitive, ask more questions about blood donation and stem cell donation. Try to register yourself with a particular blood bank as a regular blood donor, especially if you have a rare blood group, which is O negative, AB negative. Any negative blood group is quite a rare blood group in our country. Especially if you're O negative, you are considered a universal donor where you can donate to people of multiple blood groups and you can help them, save their lives. So if you have any further questions, please feel free to reach out to me at Therrapie, Hematology and Oncology Clinic. Thank you.